So it can be really confusing, the healthcare system. I work in it, I get confused at times. And when you've got a new symptom, that can be really worrying, but it can also be difficult to understand how urgent that symptom might be. So it might be a changing mole or a new rash or a new pain that you've experienced. And what we're finding at the minute is that a lot of people are worried about quite mild symptoms. So I would encourage you to have a look on the NHS website. Is this something that you need to worry about? Also, consider asking your local pharmacist, are they worried about it? Is there a treatment that they can offer first of all? As a GP practice in York, we managed to deal with most of our urgent care cases within 1 working day. And that's about 70% of all GP appointment requests. That's a huge number. So within 1 working day. And then routine problems can be anything from 5 days at my practice, and some practices are a few weeks. And that just varies across different times of year, depending on staffing levels and high demand. What happens if you think that something needs to be dealt with more urgently? What I would say is contact NHS 111. If they think it's an emergency, i.e. needs to be addressed within an hour or very few short hours, then they will direct you to potentially the A&E department or call 999 on your behalf. GP practices are there for you, but we're not an emergency service, and it's really important to understand that so that you don't delay getting the care that you need. Of course, at any point, if you think your symptoms have worsened, do contact your GP practice or again, use NHS 111. 999 is there for real emergencies, and we want to keep those ambulances available for those patients that really need them.